Look at this. It's not the swimming pool where people drown. It's in the bathtub. This was looking at about 12 patients who had drowned, and 60% of them, so more than half of patients who drowned from seizures drowned in the bathtub. So the bathtub is a big preventable cause for seizures. Swimming in a river or lake should be discouraged unless the area is enclosed. It's not someone can go indefinite distance far away, which would be too far for someone to go save if somebody had a drowning, there was a risk of drowning. Private pools, 8%, public pools, 8%, shower. There's one patient who drowned in a shower, and this is a patient who fell down, had a seizure, and his body blocked the vent. And then water filled, and he drowned in just a little amount of water. This was in this single study. Jacuzzi, 4%. But 83% of patients who drowned had low levels of the drug in their blood. So that is a take-home message. It's to take the medicine. That had a greater protective effect. Patients would not drown. So to reduce the drowning risk, ask your physician if it is safe to go swimming. Most patients who have seizures, it's safe for them to go swimming. The risk is small, provided a person is careful. If they take their medicines, if it's a child, there should be a designated responsible person to keep an eye on the child in the pool. And that's very important. It could be a coach, it could be a lifeguard, or a parent. Flotation device can be used which holds the child above the head above the water. It's very important, even for grown-ups. Should never swim alone. That should always be a no-no. And always use a buddy when swimming. Informing lifeguards and swim teachers, and avoid being overtired, because when you're overtired, you're less likely to be able to save yourself, and avoid being very cold while swimming. And not to swim if seizure medications are missed. It's extremely important, because 83% of the patients in that study had low levels of seizure medications. Status epilepticus is another risk factor for mortality. Status epilepticus is defined as very prolonged seizures or recurrent seizures, and there is no time limit. Any seizure which is felt to constitute a threat to life or well-being is considered status epilepticus. So a status epilepticus can be a seizure lasting only 10 or 15 minutes. If a person has fallen down, if the person is having trouble breathing, it's considered status epilepticus. Or if they have recurrent seizures with no recovery to normal in between the seizures. The mortality is very high in adults, as much as 28%. Although the mortality numbers have come down because of more effective treatment. But most of the mortality is actually due to the underlying cause for status epilepticus, which is a brain tumor, a stroke, a hemorrhage. And just, if you look at different studies, the most common associated finding with status epilepticus with patients with non-epilepsy is low drug levels. So more than a quarter of patients who come to the emergency room with non-epilepsy who come with prolonged seizures coming because the levels of drugs are low. Mortality is very low in children, considerably low in children, but it's much higher in adults, especially elderly patients. Reducing mortality from status epilepticus, again, you can use the same approach. You can look at what predisposes people to mortality. Getting an accurate diagnosis and treating the seizures and trying to achieve seizure freedom if possible is a big aim. If you're not going to have seizures, then you're less likely to have status epilepticus. Compliance is a big thing. Avoiding seizure triggers is big. Prompt treatment of prolonged or recurrent seizures is very important. I think that we have more technology now to prevent, at least to treat, you have more medications to treat prolonged seizures. We have Diastat, which is a rectal Valium. You can use clonazepam, you can use other medications you can give. I think there's another drug going to come out into the market. It's called midazolam. It's a drug which is already used for for sedation, but it's going to be approved for treating recurrent seizures or prolonged seizures by a nasal spray, a medicine which can be absorbed in the nose. So there are going to be more options for treating, so prompt treatment of seizures. We know that the longer the seizure is allowed to go, the more the medical complications like pneumonia, like injury, like clots in the lungs, breakdown in the muscle, irregular heart rate, aspiration, pneumonia, all those things are more likely to happen the longer the seizures go on. And the longer the seizures go on, the harder they become to treat. And there's more medications you end up using, and sometimes the medications also can cause many side effects. Driving in epilepsy. Again, it's probably overestimated that, if you look at, it does increase the risk slightly. I'll go to the next slide. We know that in 1995 to 1997, 44,000 people died on the road over those 2 years, or 2 or 3 years, but only 86 of those died because of having a seizure. So it only accounted for 0.2% of motor vehicle accident fatality. So in terms of in terms of likelihood of causing accidents and fatal accidents, the risk is small compared to other things like alcohol-related accidents cause 31% of fatal accidents. And I don't have the number for sleep deprivation, but that accounts for a big chunk of fatal car accidents. So yes, it's a very small cause, but it's a very preventable cause. We know that it is slightly increased risk. There's a much higher risk from alcohol and from sleep deprivation and from careless driving than from having seizures. But we know that if you can reduce the risk by 93% if you drive after being seizure-free for 1 year, and 85% if you are seizure-free for 6 months, which is the law in Michigan. The Michigan law states that you have to be seizure-free for 6 months before you can drive. Even that, it's a good. Some states have 3 months, but studies have shown even 3 months, driving seizure-free after 3 months can also reduce the seizure risk of fatal accidents considerably. Now, when patients with epilepsy have accidents, they don't usually report themselves to the Department of Motor Vehicles. Only about a third do. Young people account, 16 to 24 account for all a quarter of all fatal car crashes. So being young carries a bigger risk of having a fatal accident as compared to having a seizure. But again, it's a preventable cause. If you look at the different states, Michigan is 6 months. Most states are 6 months. Some states are flexible. Some states are, you can drive after being seizure for 6 months. Now, some states require you to be, anytime you have a seizure, and the physician knows about it, the physician is required to report the patient with epilepsy to the motor vehicle department, but not in Michigan. So it's up to the person who has a seizure to not drive. So preventing car accidents can be done with not driving until seizure-free for a set period of time. It could be 3 months, it could be 6 months. 6 months seems like a very reasonable period of time, but even 3 months is quite reasonable. 1 year may be a little bit excessive. Knowing that many grown-ups depend on driving for their livelihood and to get around. I think it's important to emphasize to take medications regularly. When I have teenage patients who want to drive, I tell them, look, if you won't take your medicines regularly, it's used as a bargaining chip, with the parents being there. And the parents also support that, and it does help make them more compliant. Avoiding seizure triggers like sleep deprivation can help reduce the risk of seizures and accidents.